Yeah, I think when we were talking about Momelotinib and myelofibrosis, I think right now we've had, for the past year or so, we've had about 4 approved JAK inhibitors. And so I think we've gotten enough sense now as far as kind of where do each of these stand. With Momelotinib, I think, it's certainly approved for myelofibrosis and anemia. It's kind of a broad approval. But the question is, where exactly does this fit? Because we could use it frontline in anemic patients, maybe after a prior JAK inhibitor such as Ruxolitinib. And I don't think that's very clear right now. I think we're still trying to figure that out. When we look at the data, we certainly know that there is the potential to use Momelotinib in a large swath of patients with myelofibrosis. But we also have data from Simplify-1 that perhaps Ruxolitinib may be a little bit better in terms of symptoms. And so trying to get the kind of gestalt for where Momelotinib sits, we kind of reviewed the data to show that really this is an agent that's primary attribute is its versatility, right? And so whether or not this is something that you use in the front line in a quite anemic patient who has splenomegaly and symptoms, or something that you use maybe in the second line as anemia develops in someone who's previously been on Ruxolitinib, I think it has the potential to be used in a lot of different scenarios, but it's something that we can have these more in-depth discussions with patients to kind of decide when is the right time to leverage this agent.